Good morning, Mr. Green. My name is John. I'm your student nurse for today. Doctor has given me orders to place an NG tube. Are you familiar with the order from the doctor? Okay. There's a feeling that you might have a small bowel obstruction going on because I know you've been nauseous and vomiting, and he's decided that the conservative course would be to place the NG tube. And students are expected to know that that's one of the probabilities of having that done. Again, with the procedure, I'll check a few things out. As far as the suctioning is concerned, I don't have a suction order yet per se. We have to place the tube and make sure it's in place and things of that nature. But I brought the patient's bed up to a comfortable position. Assessments done for this patient before we actually do the procedure are to listen to lung sounds and to bowel sounds and to palpate the abdomen to make sure that there's nothing going on. May I do that, sir? And he's able to converse with me. He's cognitive, as with the procedure before, I've assessed for his, that he is the right patient. So I'll listen to the belly now that I've palpated. He indicates to me that he has a pain level of like a 4 or so out of 10, and it is a feeling of fullness, and he's nauseous. Lung sounds, sir, I'm going to listen to your lung sounds now. Take a deep breath in and out, deep breath in and out, deep breath in and out, and a deep breath in and out. Okay, lung sounds are good. Purpose of listening to lung sounds for this procedure is to know what you have for sounds prior to procedure, just in case there's any concern later on if you place the tube down into the bronchial area. Next thing I will do, I will ask patient history if they have ever had a problem with anyone in their nair, as far as any kind of a break in, broken nose or a deviated septum or anything like that has occurred, and patient has indicated no. I also checked, as you saw, for nasal patency by patient breathing out one side and then to the other to see if there's any deviation with that, and there does not appear to be. At this point, I'll ask patient which side he would like for the NG tube to be placed, and he indicates to his right side, which would be on this side. So I'll prepare everything now. For the procedure, I will need the saline sump. This is 16 French, and that will be part of my documentation as well. I'll need lube. I will need a syringe to extract gastric contents. I'll need a test strip to test the pH, so I'll keep that inside the canister. And I'll need some tape to secure it to his nose. The easiest way to do this is to make sure that we set up the tape ahead of time by making a Y shaped formation with the tape, much like what the trach looked like just before us, to place the around the tubing on the nose. Okay, so I will wash hands. I will put on clean gloves. Clean gloves are all what is needed for this procedure. It is not a sterile procedure, and students are also expected. How are we doing, Mr. Green? Okay? He indicates that things are fine. So, Mr. Green, when I get this going for you, I'm going to ask you to swallow at one point, okay? There's a sign above your bed that says you're MPO, so I'm not allowed to give you any sip of water or anything like that to help with the passage of the tube. Have you had a tube before, by the way? That's always a good question to ask for any skill if they've had this procedure before, so you kind of know where to start with their education as well. Indicates he's never had a tube before. So, sir, I'm going to raise your head up a little bit. This may help with the passing. Okay. I'm also going to ask if I can gently take the pillow out from behind you. And he says I could, and I'm going to gently place his head back so I can get clear visualization once the tube is going past into the pharynx to see if there's any coiling going on. Okay. So at this point, I'll open up my equipment. I notice that it's a brand new setup here, and we have a connection piece there, which is important because we always seem to lose those. It's important to make sure that we maintain that for obvious reasons, which I'll explain a little bit later. Okay, so for measurement, sir, I'm going to take this from the tip of your nose to your earlobe, and then I will bring it down to the xiphoid process, and then I'm going to go about another inch or so just to make sure that we get past that gastric sphincter. Okay, and for documentation purposes, it's at a 55. Some tubing does not have any marking as such, so it's customary putting a piece of tape there and or making a mark with a marker to the area. But I know from my documentation that I can say it's a 16 French Salem sum. Okay, so now that I've done that, I can put a generous amount of lube onto the tubing, so passing through the nasal passage down into the stomach is easier. I've done that. Sir, when I tell you to start swallowing, please do so I can pass it through, okay? Okay, begin swallowing now, sir. Okay, and as we're doing that, we're checking. We don't have any resistance going through. If you do have a little resistance, you can always twist the tube towards the opposite nair to help get through the passage, okay? And for purposes of demonstration, we'll say that we did get down to the 55, as the mannequin won't allow us to go any further. Okay, once we've done that, I like to gently place the tape on now. Some literature is saying that it might be good to do that a little bit later, but I know from doing this, I can, in my documentation, say that there wasn't any coiling, that the patient didn't have any dyspnea, redness in the face, hoarse voice, wasn't trying to physically stop me from placing the tube. It was a well-tolerated procedure. So now that we have that in place, I can take off my connection piece temporarily and then place the syringe to the end and extract some gastric contents. And the instruction for students would be 10 to 20, and I see coming out some green bilious type drainage. So I will now disconnect that, place that there, and then quickly close off or clamp off the tubing as to not get gastric contents over the patient's bed in person. With this, I will take and do a check of pH, and the pH is between 2 and 5, so that would indicate acidity. So that would match up well with that situation. Again, I can auscultate lung sounds as well. There's another identifier. So Mr. Green, please take a deep breath in and out. Okay, in and out. And lung sounds were clear before, lung sounds are clear now. Okay, so the remaining indicator would be having the patient go down for a chest x-ray to verify placement through that process, and we have done that, and he is back on the unit, and I checked to see that he is at 55 and that he's comfortable. He's back in his bed, and the x-ray has come back as being in place, so then we can further help the patient with whatever orders doctor has from here on out. We're ready for suction if needed.